Justine is a 27-year-old woman. 3 months ago, her life was spiraling and she was living in a shelter. She had so much going on in her life and was often feeling overwhelmed and scared. Justine was diagnosed in her early 20s with depression. Additionally, she had struggled with substance use since her early teens. She often felt hopeless and alone. When Justine was younger, she loved to hike and play soccer. Justine does well when she regularly takes her medications, exercises, and spends time with friends. However, mental illness and substance use have negatively impacted nearly all aspects of Justine's life. Justine hated the side effects of her medications, so sometimes she did not take them. She was also told she had diabetes and had to take more medications for that. One more thing to overwhelm her. Justine developed an infection in a wound that required dressings and intravenous antibiotics at the home health clinic. At least the dietitian who helped her manage her diabetes was in the same location. Justine had so many things going on in her life. She often misses appointments, was feeling angry with her life and people around her. They all expected her to do so much on her own. She wasn't feeling well, and she had difficulty knowing where to start. Justine decided to call the Mental Health and Substance Use Services at 310 MHSU. Justine was assessed and connected to her most responsible clinician, Matt. Matt is a counselor. He arranged to meet Justine at the shelter. Matt asked Justine, "What matters to you?" They talked about her alcohol and cannabis use, her frustrations with life, and feeling overwhelmed by all her health needs. Matt also asked Justine, "Is there anything you would like to do for your health in the next week or two?" Justine identified one short-term goal. As her most responsible clinician, Matt explained to Justine that he could help her communicate her wishes and goals to her care team. Matt connected with her primary contact at Home Health so they could work together to ensure her care was well coordinated. He also supported Justine to improve her finances and housing situation. Matt helped Justine explore various aspects of her mental health. At times, she felt so hopeless that she wished her life were over. He helped Justine identify strategies to stay safe. They now have a plan that includes 24/7 support from the Interior Crisis Line if needed. They discussed strategies to help her reduce her substance use and increase her social support. Justine knew these were all important in her journey towards wellness. A lot has changed for Justine in the past few months. She's been regularly attending counseling appointments with Matt, and he has connected Justine with a peer support worker that she can relate to. She takes her medications regularly, and the dietitian at Home Health is helping her make better lifestyle choices to manage her diabetes. Matt and her other care providers work together to ensure Justine feels supported. Justine is feeling much better and has regained a sense of hope. Because of the integration of services within Interior Health, Justine knows where to turn when she needs help. It seems that every door is the right door. Interior Health provides integrated care following trauma-informed, culturally safe, and recovery-oriented principles. And the person receiving care is always the first priority.